the processing of swabs for PCRs was centralized, and that resulted in some serious backlogs. Madam Speaker, despite a clear offer from BAHA and the IAEA in April 2020 to assist with PCR testing to the Ministry of Health, that offer was never taken up. The then administration of the Ministry of Health brushed this offer aside. The IAEA offered to purchase consumables for testing. If this request had been taken up, the decentralization of testing could have already occurred. With the current climate and big countries buying up most of the supplies and consumables, it now takes approximately 10 to 12 weeks to get these items. The backlog of PCR results, the increase in the number of infections, and in the number of deaths can be squarely placed on the previous administration. Our government hospitals were not fully ready to deal with the cases that we have experienced. The Ministry of Health had ample time to rectify and to address the gaps. We found that the Ministry of Health headquarters was giving out orders without being fully abreast of the reality on the ground. The budget for the Ministry of Health was cut by 40%, and this was despite the fact that the MOH was required to respond to the pandemic. Overtime for healthcare workers was cut. There were restrictions in new hiring for the Ministry of Health. Madam Speaker, the first case of COVID-19 in Belize was on the 23rd of March 2020. 18 cases by the 11th of April 2020, followed by 58 days with no cases. The country went into a month lockdown with the appearance of the first few positive cases. The previous administration should have used this time to develop a clear strategic plan to deal with the pandemic and to equip the hospitals and healthcare workers with the needed supplies. They, Madam Speaker, should have used this time to decentralize the processing of PCR samples. People tested were waiting sometimes up to 30 days for a result, and this contributed to the spread of COVID in Belize. Madam Speaker, the Carl Huchner Memorial Hospital, our tertiary and referral hospital, was left in shambles by the previous administration. An analysis of the institution reveals that the causes of adverse outcomes at the KHMH are due to understaffing, inadequate oxygen delivery, poor electrical system, insufficient medical supplies and devices, inadequate infrastructure, and inadequate leadership.